Hospitals are asking the governor for help as pediatric wards statewide remain at or over capacity. Hospitals report a surge of flu, RSV, and now some COVID cases among children. There is enough space for adults in hospitals. The Nevada Hospital Association asked the governor to allow hospitals to operate outside of licensed capacity, all to deal with the need and allow out-of-state nurses to help. The governor's office says they are responding. And many hospitals across the valley are operating now in surge mode, all to treat the spike in sick children. One doctor at Sunrise Children's Hospital says, "We haven't seen the impact yet from last week's holiday gatherings."
When we say that influenza is in a high surge right now, that is the true flu virus. Most of our pediatric patients, they are having breathing issues, dehydration issues, runny nose, congestion, fevers. We're seeing numbers of patients each day that are more than our typical record days from years gone by.
Sunrise Children's Hospital working with other Valley facilities to manage the surge of cases of flu and RSV among children. Sunrise even converting a space just to increase ER capacity by a third. Most children, according to Associate Medical Director Dr. Jacob Snow, can be treated and go home, but the most vulnerable are babies.
The ones who are most likely to need hospitalization are the very young infants. That's the most worrisome.
Across the valley, there are longer wait times in busy emergency room lobbies, and Dr. Snow warns that also increases the spread of germs. When should you seek the hospital or stay home?
If your child looks reasonably okay, if it looks like they have a cold or flu, it is absolutely best and okay to stay home and go see your regular doctor. On the other hand, if you have a young infant with a fever, or if you have a child who's medically more vulnerable with some other medical complication, or if your child is consistently having a hard time breathing, showing what we call severe retractions, if they're excessively lethargic, if they're failing to drink and getting dehydrated, those are the more severe patients that should come to the hospital.
Some other advice from Dr. Snow: get your kids the flu and COVID shot to make sure they stay healthy. And if someone is already sick at home, it's a good idea to mask up so you or other kids don't get sick, and keep your sick child away from other children, school, and daycare.